Welcome to our Healthcare Workforce webinar series, where we explore the innovative ways communities are supporting those who care for us. Today, we are joined by Dr. Katrina Browning, Interim Dean, and Justin Brattleboro, Business Workforce Development Officer at St. Ambrose University, to share their journey to create a flexible online LPN to BSN program for rural place-bound learners across 9 states and growing.
I am going to start by asking for just a little overview of the online nursing program in general.
So we brought on board an online LPN/RN to BSN program in the summer of 2023 is when it started here at St. Ambrose University. The main mission of that program is to reach rural place-bound learners who don't have access to upskilling their education because they don't have the ability to relocate. And so we're really trying to reach individuals where they are at. With that being said, it serves students currently across 9 states. I will just share a little background of how the program came to St. Ambrose University. So we had, as we see a lot of small private colleges are struggling in the world today, we were contacted by the Presentation Sisters, who had started Presentation College in Aberdeen, South Dakota. That college has since closed. They closed in 2023, and but 25% of their population of students was in the online LPN to BSN program. And so that program in and of itself is very strong, even though the institution was not financially sustainable. So we partnered with them. They've been a great partner, the sisters have. And so we really have that mission aligned with the mission of St. Ambrose University to serve individuals who don't have access to education and give them that access. And so we partnered with them. We brought the program on, and we're continuing to grow it, expand it, provide access to more individuals who don't otherwise have the ability to upskill. So
that is so incredible. Thank you so much for sharing that. And I'm very curious because our own state in Iowa is very rural. As you know, we're struggling with our own healthcare workforce shortage crisis. And you shared that you're serving 11 states, soon to be 11.
soon to be.
And not to put you on the spot, but are you able to name like all the states that you currently serve and offer?
Yes. South Dakota, of course, since that's where it originated. North Dakota, Minnesota, Wisconsin, Wyoming, Nebraska, Colorado, Iowa, and Illinois. So we added Illinois when we brought the program on. The other states already had a footprint with this program. So there were students in Iowa attending, this school in South Dakota for this online program because it met their needs. And then we added Illinois, and then we are expanding to Missouri and Arkansas.
Fantastic. Still keeping it Midwestern based.
Still Midwestern, rural, still serving the mission of that it started from.
Wow, that's incredible. I'm curious if you can talk about, you talked a little bit about how this idea came to be, but can we dive a little deeper onto the timeline for planning and implementation to really bring this to life?
Yeah. So we spent, I will say I was under a non-disclosure agreement for a year in a lot of the back end planning for determining, financial feasibility, but how would we staff it, those types of elements to determine what resources we would need to bring on board for St. Ambrose University in order to go live with this. And the announcement then came out officially in January of 2023 that from Presentation College and St. Ambrose University. And then we enrolled the students in May of 23. So we brought on the curriculum that the students were currently in, as opposed to trying to merge them into our curriculum that existed at St. Ambrose in order to have those students who were transferring to us as a teach out to have a smooth transition. And so we have since then brought our curriculums into alignment over the last couple of years. And actually this week with finals, we will wrap up the original curriculum from Presentation College, and we will have all students now in a merged curriculum officially in the spring. So it's been an exciting timeline over the last couple of years to go from bringing these two and then kind of merging into one jointly created curriculum.
Wow, that's amazing. Congratulations. That's a huge feat. Yeah.
So it's been a few years in the making.
Yeah, that's a very short kind of launch period. That's incredible. Very curious on discussing who your key stakeholders and decision makers were to really talk about the planning process to really get this off in such a successful manner.
So I would say we worked very closely, obviously the sisters who had a lot of buy-in, and we're very connected with some of the healthcare systems in the region. And so we quickly joined in with some of those healthcare partnerships. And then also presidents across both universities as we were, in this initial period. I was working very closely with the nursing director at Presentation College, there's a lot of data I looked at. I think in November of 2022, I have a document, it's 11/29/22, as a matter of fact. That month, I looked at about 150 blinded degree audits to see where students were at in the program and what courses they would need and when, to try to get an idea of what we were going to be doing. So there's a lot of back end
Mhm.
planning, but resulted in a very successful shift. So when we started and shifted the program to us in May 23, we had 120 students transfer to us
Yeah.
that summer. And so it was a very significant lift, but uh, the students were so appreciative that there was a partner who was going to continue with their educational journey, that their dreams didn't, just die out because of the financial challenges of the parent, the original institution. And we're just grateful to continue their journey. And so that has been just a blessing. And then to continue to, just grow it from there has been really, really exciting to finalize.
We've talked a lot about the pros, and for our listeners to really glean if this is something worthwhile for their communities, wanting to talk about some of the challenges that might have occurred. So any regulatory, technology, or any instructional barriers that were in place, and kind of how those were addressed through this very quick timeline to support students that were already partway through their program.
So let's start with regulatory.
Mhm.
So nursing, as bachelor's degrees in nursing have to be accredited by a specialty accreditation. So we had to work with our accreditor, which is CCNE, to make sure that we were good with their requirements to bring on an additional pathway within our BSN program. With all of the curricular updates, we had to maintain close communication with them. Plus, we're based in Iowa, so we have to function under what the Iowa Board of Nursing regulations are within the Iowa Administrative Code. So no matter what state the students are residents of, we still have to make sure that we are following Iowa Board of Nursing regulations. And then because every Board of Nursing is different, in
Mhm.
any state in which we have a presence, there are varying requirements for what we need to be submitting to the boards of nursing in those various states and at what types of intervals. That is one of the key things. Technology wise, we really have to lean hard on our learning management system. And so ensuring that you have, I'll use the abbreviation LMS, which is what we say in higher ed. You really need an LMS that can be built for online learning and follow online learning best practices. Along with that, instructional teaching online is not the same as teaching in a classroom. And so
Mhm.
upskilling faculty to be able to truly teach online in an intentional, meaningful way that meets the federal regulations of regular and substantive interaction with the students requires some upskilling of faculty as well. We recently, this fall, also have put in place, we now have an associate vice president for online learning who will help to ensure some of those best practices are in place across all of our online programming, which
Mhm.
is exciting that we're starting to work with her to just make sure that we are really all doing a really good job in teaching in online modalities in a way that is best for the learners. Uh, we've learned a lot too about the learners who choose online education. So we're serving rural place-bound learners. They're choosing this program because it's the only way they have access to um, furthering their education, not because they really know how to learn online. In fact, many of them really don't come in with a skill set of how to be an effective online learner. And so we have a nursing student success coach who works really closely with the students. We have started a pilot course that students take before they start nursing courses that hopefully we've piloted it 2 times now, would likely become required as part of pre-nursing. It's no cost to the students, but it's really to give them the tools in their toolbox to be successful as online learners, because we can't just assume that they know how to do that, because it's different. It's very different than being in a classroom and having an instructor right there and going to office hours. And
Yeah, totally different
it's a
skill
different
set.
world. Yeah.
Yeah, fantastic. So we've talked a lot about the barriers. I'm actually very curious because we talked about instructional barriers that may or may not occur. I'm just curious if all of your instructors are based in Iowa, or since you
They're
serve so
not.
many states, they're
They're
not. Okay,
not.
very
So
curious.
yeah, so when we brought the program on, we recognized that, we could actually have faculty. One of the challenges in Iowa is just a nursing faculty shortage as well. And
Mhm.
so we recognized we didn't need faculty who we're here on campus to teach fully online. And
Right.
so we added 3 additional faculty to support this program. Then we have a good pool of adjuncts. Our faculty one of them is in Iowa, but about 4.5 hours from our campus. So she's fully remote. We have a couple we have Arkansas, Georgia. We have adjuncts that are in Michigan, South Dakota, Minnesota. We pull from a variety of places, particularly for the clinical adjuncts who go with the students into the group clinical placements. We pull from the communities in which those students are going to be going to the clinical in. So yeah, we have people from all over.
Yeah, fantastic. And since we kind of touched on the employer partnerships, let's dive in there about how using this LPN to BSN program is reaching those place-bound learners, as you said, and how these employer partnerships are supporting that workforce initiative to get them trained and ready to step on the floor right after graduation.
I will say probably our biggest partner right now is Avera Health System, which is Iowa, South Dakota, North Dakota, and a few other kind of around that footprint. But I will let Justin talk about some of the work we're doing with Avera and some of what they're doing to help make this program attractive for students in that footprint.
Fantastic.
Yeah, and before we get into that, I even want to share, we haven't quite touched on the fact that this program, of course, features online classes, but it also features the ability to customize course load as well as take semesters off. Of course, there's some requirements to that, but I wanted to highlight those because not only does those benefits benefit the learner or the nurse looking to upskill, but it also benefits the employer as well. If we take a hospital system who wants to upskill their LPNs to RNs, one of the challenges they face is having to staff, for that nurse to go to school multiple times a week to go to it. So as Dr. Browning mentioned, we work closely with Avera Health System. They have really been our key partner in kind of piloting how we work with health systems across all of the 9 states. Everything from scholarship opportunities for the students, a lot of places are doing that, to even allowing us to come on site and speak with their LPNs, one-on-one. Dr. Danielle Hoffman, our nursing program director, and I, we went up there, we traveled to a few different Avera sites, and just rounded to each department to tell LPNs, why they should continue their education and how our program helps break down some of the barriers of what's holding them back. So we're really grateful for the opportunity to work with Avera Health and kind of all the support they've given our way. One of the other things we do is like tuition discounts or continuing education opportunities, are just some other ways that we kind of partner with health systems to support their teams.
Yeah, fantastic. And Justin, you did a great job of setting me up kind of for my next query because you talked about some of the barriers that might be faced by students to come in. And sometimes even the employer, it's just not best practice for them to have a student take semester to semester to go further in. But what other challenges are you seeing for these rural place-bound learners? And how does this type of program address additional challenges to make sure that you're able to serve folks where they're at and get them through the program at the pace that works for them?
Yeah, so most of our students, they're all attending part-time. We don't have students in the online program who attend full-time. It is not a cohort model,
Mhm.
which really all nursing programs follow a cohort model.
Mhm.
And so this is really unique. So in that it's not a cohort. They can progress at a timeline that works for them. They can take one class at a time. They can take a few classes at a time. So it's really designed to flex to meet the demands. Our goal is to reduce any barriers that might exist in order for the students to return to school. One of the things we're looking at right now is because we cluster the group clinicals for a weekend, so we might have students who might have to travel a couple of hours or sometimes even more than a couple hours because we identify a facility and an adjunct faculty availability at basically we put all the zip codes in for the students who are enrolled in the given semester and then we try to see what's kind of central to that.
Mhm.
And so we actually have an endowment now that will allow us to offset some of the travel costs for some of the students. So we're working on operationalizing a plan for students to be able to access some of that because that is a barrier for them to be able to travel, especially if it's a couple hours and they're doing 312s in a row to stay in a hotel. They've gotten really creative. They room together, they carpool if possible, they do all those things. But how, we're working to identify, okay, how can we offset the barrier of those travel expenses? And so we have just some wonderful donors who have been so supportive of the needs of this program that we will now be working towards some travel support, which will be.
We talked a lot about, how these are role-place learners and how they can be across the various states that you mentioned. Wanting to hone in on Iowa and how has offering this online program really impacted your ability to recruit, train, and retain nurses within our state?
So since the program has come to us, we've definitely seen a growth in Iowa residents interested in the program, given that it is, funded right within the state that they live in.
Mhm.
Over the last 12 months, 30% of our applicants have been from Iowa. So we're seeing a third of the current applicants come from Iowa. And of that 30%, half of those are from rural areas in Iowa, which is really exciting that we can definitely see that we are serving rural Iowa through this program. So that was applicants, and then 30% of the current students enrolled in either pre-nursing coursework or nursing coursework are from Iowa. So we are really serving Iowa well, which I love. And I will say the other part that we track is the demographics within this student population. The average age of applicants from Iowa is 40 years old. So these are people with family who are very definitely place-bound, raising their families. And so that we're serving a different age of student than what you would traditionally see college age. We're not seeing traditional college age students in this program. That's not what it's designed for.
My main last question is we talked a lot about this program, the ups and downs, and like your timeline for growth. For our listeners that are thinking about whether or not this is the direction they would like to go to increase their nursing program and their reach, what key takeaways or lessons learned would you like to share for them to consider if this is the best course of action for them?
So at one point, because we brought this program on from another institution, and at one point, our somebody, and I don't remember who it was, they said, what would it take for us to just start this from scratch and not, necessarily partner? And I was like, it would be almost impossible. And so it would be a big lift to design this because you've got to, we were able to already bring on partnerships and relationships with healthcare systems across the states that were already being served by the program. And so it kind of was like a plug and play a little bit for us that would have been, we would have needed probably 2 years of just prep work to start something as well designed as what this is, in order to get it off the ground, because you need you got to do all the legwork with the boards of nursing and the healthcare partners across those regions to start to form relationships, because it's successful because of the relationships that we have with those entities. And so that relationship building would be probably the biggest key to take on if anyone was going to consider doing this type of process, is to know you're going to have to take some time to build relationships. And yeah. So what I will say, and why I can reflect on that, is we did initially see a little dip in enrollment because now the brand of St. Ambrose wasn't as recognized by some of those. So when you go into another state, you lose some of that brand recognition where they're like, oh yeah, we know St. Ambrose, they're really good. So we had to reestablish some of those relationships, but we had previous ones that we could build on. And so that part is hard.
Yeah, that's a completely fair point. I wasn't thinking about that. I'm from Davenport. I grew up very close to St. Ambrose, so I, of course, know all about it. But if I went to another state and just plopped myself down, I wouldn't know the local college or university that's there and their program. So that's a great point. So thank you for that. Justin, do you have any last minute takeaways or lessons learned you would like folks to hear about?
Yeah, I think a lot of people, even myself, we want to upskill, we want to continue our education, but we don't always know what pathways exist for us. And so I think that one of the things that both employers and universities can continue to work on is just educating, potential students, professionals on the pathways that exist for them. Because many don't know that we have an online LPN to BSN program that could fit their needs. And so I think that as we move forward, that's one of the things for kind of everyone just to consider.